As therapists, it is important that we have a good, strong understanding of risk factors and protective factors that help us as we're trying to reach individuals and youth and adults as it relates to violence. People come in and they're dealing with anger issues or they're dealing with behavior issues, but as therapists, we understand that underneath particular behaviors, there are some issues that are underlying that we need to deal with. We characterize this in two very important areas. One is risk factors. Risk factors allows us to take a look at the different things that a person could or possibly could have been experiencing or exposed to that could set them at a greater risk for violence, for substance abuse, or for other types of mental health issues. The other piece that we look at is protective factors. Protective factors are those areas which help us to see what contributes to a resiliency on a person's part. And so we try to have matching protective factors that go with risk factors. Part of our conversation and dialogue is going to be looking at factors in an individual basis, family basis, peer social basis, as well as community. And we look in those areas for risk as well as protective factors.
I am honored tonight to have with me two of my colleagues who have worked extensively in the area of depression with youth and with adults. Tonight, guys, let's have a dialogue. I have Shirley Miller with me tonight and Damon Cobble. Let's start with introducing yourselves.
Well, I'm so glad to actually be back again. I am a licensed marriage and family therapist associate. In addition to that, I do work around the city of Louisville, Kentucky with children, adolescents, adults, couples, and do a lot of work with women as well, particularly.
And I'm Damon Cobble. Again, thank you for inviting me to your show. I also am a licensed marriage and family therapist associate, and I have worked with individuals, families, couples, and also adolescents.
Okay. I'd like to start just right off in looking at, we've had a conversation in our past in looking at the systemic impact that violence has had on us as a nation and us as a culture. Let's talk a little bit about abuse as it relates to kids. I know you both have extensive experience in working with kids. When kids experience maltreatment of any type, of any magnitude, that it is has a serious implication on them, and it has serious impact. Let's just talk about some of the things that you've seen as therapists with kids.
Well, and the first thing that I think that's really important to note are the risk factors that we all talk about. What puts a child at risk for being that child that is maltreated? And so a lot of times, which it all ties in, we've talked a lot of times before about the family life cycle. They may have a parent who is negligent or just not attentive to them. There may be alcohol or drug abuse that's happening there. There may be a child that possibly is in the care of maybe a family member who does not have a vested interest in them because a parent is distant or not around. And so the biggest part of that, when you have a child that has not developed that, I guess one of the ways that we describe it is positive, healthy attachments. A lot of times they are prone to just act out in lots of different ways.
And also research shows that it's the first 3 years of a newborn child's life that develops their personality. So that attachment is critical to developing that child's personality. So if that child is not receiving those nourishment, those needed variables to help raise him and nourish him and help him cognitively, then you're looking at some adverse situations in the future.
Yeah, and those are all examples of how risk factors, if they're not protected, yes, that it sets them up for potential violence.
Yeah.
Okay.
Yeah, and that's risk factors within the actual family.
Yeah.
That's not even talking about what happens in the community or what happens in the state or in the nation.
Yeah.
There's so many different things that play into that with children. So we start to talk about bullying, for example, and things of that nature. You know, kids they fall into this pattern of acting out of things that they've experienced, and it just goes on and on.
Yeah, I agree.
unhealthy environments, children who are brought up witnessing unhealthy relationships, children who are brought up in communities inundated with drugs and gangs. And all of those factors plays a part in that child's development and what they deem as normal and what they see as abnormal, you know, as they get older. So if a child is brought up in a community or an environment that is unhealthy, that's inundated with drugs, gangs, mother being the victim of domestic violence, that definitely plays an impact in their child's psychological functioning as they grow up.
Okay, so we see them in school and we see them expelled, or we see different issues going on with them in school, not able to learn or even to function on a daily basis. And then we get a lot of the diagnosis or the different things. And that's where we get the underlying factor of depression.
Yeah, and speaking specifically of African American males, like you said, you know, and that's one of the big problems with African American males seeking treatment, seeking therapy, and the stigma, the taboo, that is reinforced not only by society, but it's reinforced by the black family. It's reinforced also by black churches, and that's research based. And so you have three external factors that's also influencing that family system, that's reinforcing those negative experiences, you know, that teachers don't understand. Yeah. Teachers can't understand. And sometimes parents don't understand, you know, what their child is going through because they're totally oblivious, and what it's subconscious to them, you know, and it also affects their parenting skills.
I agree.
This episode was brought to you by Creative Spirits Counseling Center, transforming lives into creative spirits. 3 locations: Shelbyville, Louisville, and Danville, Kentucky.
Okay, let's talk a little bit about, we've talked about children and some of the impacts that it has on children, but once a child is developed and they're now an adult, maybe a single adult, early adulthood, and trying to now navigate their way independently, what are some of the things that we know, if unprotected, there's no protective risk for the individual, what are some of the things that we see today that in our offices that show up as it relates to behavior with young people?
Oh my goodness, in terms of especially that young adult age, like we go back to talking about the fact that they've not established that healthy, you know, attachment with someone, and so a lot of times they can go from one bad relationship to the next. You know, people have problems being able to, you know, understand their worth and their value, and so they'll allow themselves to get into any kind of relationship, and so you start to see the potential for intimate partner, you know, violence like increase. You start to see the possibility of increase of people doing more like self-harm addictions, you know, start to come to play. And so when those protective factors are not around, for example, having a healthy support network. If you're somebody that's never had, you know, healthy attachments, and all of a sudden you don't have a healthy network of people to help encourage you when you hit into a rough spot, then you just find yourself transitioning just very roughly from one place to the next.
Yeah, I agree. I know that when we start talking about violence and looking at some of the stages of violence, we look at emotional violence. There's different types. So we have people that we've talked about that have been neglected emotionally. Then we have people that have experienced physical violence. And so that is the actual touching, hitting, slapping, punching, that type of thing. And then we have what we call sexual violence, where people have either been sexually abused, sexually assaulted, or raped. And then we have abandonment or neglect. And those all constitute violence. We know that as a nation, that those are things that have been perpetuated over the span of time. And so as we're working with the clients that we work with, we know that they present as depressed, or may present as persistent depression, or they may present with some type of depression. And looking at those areas, what are some things that you see could help in working with families? What would you say would be some of the tips that we could actually give in working with families and helping to address some of the issues and some of the stigmas that you mentioned?
Yeah. Well, I think, you know, as the child is growing up, I feel that it's important to allow that child to be expressive, to externalize what their thoughts and feelings are. Even though they may not understand what they're saying, but giving them that opportunity to just let it out. You know, and what I tell parents is we may not agree, we can disagree, or we can agree to disagree, but you give that child, give that teenager an opportunity to express themselves. Because if you look at our history, you know, even post slavery, we have been taught to suppress. And I'm speaking specifically of African American males.
Okay.
We have been taught to internalize and suppress, and not to minimize women's efforts in the civil rights movement. But men were pretty much at the forefront of the civil rights movement, you know. And we took all the bitings and the fire hoses and the beatings, you know, and the killings. And so we have been taught over history to internalize. Now what's happening is parents are reinforcing that. Some parents, because you have the masculine role norm. You know, I grew up, you know, at a stage and at an age where I was told, you know, boys don't cry, you know, keep your mouth shut. And so what that is, that's training me to internalize. That's training me to keep it built up. And what I'm seeing is these teenagers, as they get older, you know, they don't have the skills. You know, they've never been allowed to express their thoughts. You look at it even in the school system, you know, they're told to just obey and follow whatever the rule is. But they may have a legitimate, a rational, or a logic complaint or a reasoning behind whatever they want to talk about. But not allowing them to externalize that, you know, that just builds up more frustration. And I think that's where you see happening in the streets, in the school, more violent behavior, even in relationships.
I agree. I also think that, and I hope you guys would agree with me, that leads to the gang violence and leads to a person actually going to a place where they can be more accepted and can be able to express. And the expression that we're seeing a lot with the gang violence and the various types of cliques that young people become affiliated with, they tend to have that rage, you know, the rage comes out. What you express as being internalized, it now comes out externally, but it comes out in negative ways.
Yeah, and that comes out in many different forms. It comes out in domestic violence, it comes out in manipulation, it comes out in stress. Of course, you know, our immune system is only designed, you know, to fight off one stressor at a time. And so if you got a teenager or even adult for that matter that's dealing with society stressors, family stressors, the common cold or flu, you overwhelming your immune system. And what happens is eventually there's going to be that straw that breaks the camel's back. And it may not be for that specific reason, you know, it's just over time things have built up. And then now you see kids get suspended more, you see more domestic violence, you see the recidivism, you know, very high, you know, with the prison system. So it's a systemic issue, you know, as you mentioned, but it's going to take a system to try to fix it.
And you asked earlier, like, in addition to what you said, just is so on point. And I think what you bring to the table is the fact that knowledge is power. Being able to educate, you know, these families about norms and abnormal things, and the fact that, you know, you're going to deal with emotions, you're going to deal with life, but what are some optimal, healthy ways that we can go about helping you to handle and deal?
This episode was brought to you by the Brick Room of Shelbyville, Kentucky. Let us plan all of your events for you.
So I think I have to agree with both of you. So in order to deal with the systemic issue, the negative that we've experienced, the stereotypes and the different things that have impacted, in order to take the risk factors and make them protective factors, we have to use those types of skills. Being able to open up and talk, being able to educate. And I think just being able to create a place where people can actually, and I think that's what our rooms are. That's where the rooms of recovery are. And when we speak of rooms of recovery, we're talking about whether you're going in for counseling with family therapists or you're going in to see a psychologist or psychiatrist. Those are the rooms of recovery. Whether you're looking at a 12-step program or you're looking at, those are all inclusive of rooms of recovery. But we need to be able to identify and say that, hey, these are our issues, and then be able to talk about them and then educate ourselves about those things. I think that's important.
Yeah, and that's very true. You know, I have 2 couples that I'm working with currently, and, you know, I do individuals, then I bring them together as a couple. But, you know, working with the males, you know, I have them go back to their origin of, you know, to try to identify the onset of their behavior. And what I found, what was common, the common variable between them is it starts in their childhood.
Yeah. Yeah.
You know, that dysfunctional, that maladaptive thinking started at a very young age, and then it's reinforced, reinforced by society, reinforced by family members, reinforced by your spouse or a significant other. And that's a problem that I think that that needs to be addressed. And like you said, allowing that safe place, that safe haven to be able to express and talk about those experiences, so we can help them rewrite their chapter in their life.
You know, it's so funny that you mentioned, you know, them being able to go back to their childhood and how so many things reinforce. One of the things that we often can kind of neglect on a macro level, society really helps to reinforce in terms of television, videos.
Yeah.
People do videos, you know, still nowadays. You know, a lot of those things reinforce those negative stereotypes, and it makes it the norm.
Yeah.
You know, instead of it being the abnormal thing. Well, it's normal for, you know, a woman to be hit or to have multiple sexual partners at the same time. That's the norm, according to society's standard. And so even being able to, you know, get to, you know, the macro society, getting into entertainment and getting some positive images of things portrayed out there and making the positive, the healthy, the norm for people to kind of look up to.
I think it goes back to when wrong seems right.
Exactly.
You know, and so we act on that. I know it says in Scripture, I remember a story about Moses in Scripture where he was up in the mountain, and while he was in the mountain, the children of Israel, who he was leading at the time, because he was absent from them, they went back to their old ways. They were in the middle of the desert and were thinking, hey, we have no hope. And when people have no hope, they only go back to what is familiar. And so in Scripture, it talks about how they started collecting all the gold, and they started and then making a calf of gold so that they could worship. They wanted to worship. Their intention was right, that they wanted to worship, but their action, who they were worshiping, was wrong. And I think some of the things that you've talked about today is just that. When we don't have a good, strong voice, when we don't have someone in our village or in our community that can speak to us and say to us, hey, the way you're living is not right, or the way that you're living, there's a stronger, better way, and it doesn't have to lead to negative. Because I remember when Moses, in reading in Scripture, and I know you know the story, when he came out of the mountain and he had just gotten the law, he had just gotten the 10 Commandments from God himself, and when he came down and he saw that the children of Israel had gone back to their old ways because they had no hope. And I think that's what happens that is what has happened to us as a nation, that our times are so different, and that the leaders in every village, whether white, whether black, whether Gentile, whether Jew, whether, you know, whatever culture you come from, that when our leaders no longer stand and they no longer show us the way, or when their ways seem obsolete and there's no path to follow, then we're more apt to go back to that which is familiar and that leads us to no hope. And I think that's what you spoke to tonight.
Yeah, and that kind of ties in with what we do when dealing with depression or dealing with any other other disorders for that matter, is you do a lot of self-talk, a lot of positive self-talk, a lot of cognitive behavior therapy, and a lot of reframing. And what we're doing, we helping them to see possibilities. We're helping them to see a different perspective. That perspective that maybe wasn't reinforced as a child. You know, those good characteristics, those good qualities that person may possess that has never been cultivated. And so that's one thing I love doing. That's why I love doing what I do. You know, and you kind of, you know, just helping them kind of see a different perspective and letting them know that there is another way. There is another way. And it's difficult, you know, with the violence, for example. You just can't, you know, it's my belief that you just can't tell a kid, put the gun down. I think it's important to really sit down and talk with that child and understand where that thinking's coming from. Where did this thinking start? Let's go back to the origin. Let's figure out, you know, where this started and help you see, listen, there's another way, and help them to rewrite that book.
I agree. I agree. That self-narrative is so important.
Yes.
And being able to go back and the rewriting the story, I think that is so critical that we're able to do that. And I think, you know, the rooms of recovery are open to that. And I'm so glad that we are open to having this dialogue and really help to remove the stigma and remove some of the barriers that keep people from coming into the rooms of recovery to get the help they need.